In 2020, at the young age of 68, my mother was diagnosed with frontotemporal dementia, a progressive and irreversible brain disorder that affects an estimated 50 to 60,000 Americans. After many years of unexplained mental health concerns and her distrust of medical professionals and the medical system, including a medical emergency, we received this diagnosis which changed the course of our lives forever. In many ways, the diagnosis gave us some answers to past actions and behaviors, as well as a greater understanding of how to support her on what is a very unpredictable journey. So, in this episode of Deep Dive, I invite a fellow FTD caregiver, Corey E. Sanison, who also lost her mother to FTD dementia in 2019. As they say, if you've met one person with FTD, you've met one person with FTD. How this disease shows up for people can be entirely different. So the course of their lives, behaviors, and physical appearance can all look different, while the names they may use are used interchangeably. They all refer to the same underlying condition that affects the frontal and temporal lobes of the brain, leading to progressive cognitive decline and changes in behavior and personality. So while Corey and I don't have all the answers, we share our stories from two perspectives, ranging from variants of the disease to the relationships with our loved ones, and ultimately our experience with caregiving in the healthcare system, in hopes to spread awareness and provide support to the families currently affected by this disease. Corey, thank you so much for coming on here and sharing your story. We've got a lot of conversations that we're packing into this one episode today, but would love to hear more about you. And, I know you're the founder of ISA Yoga as well as a volunteer with AFTD. So kick us off. Tell us more about your background and what your work looks like with AFTD Foundation.
Well, thank you so much for having me. I'm super excited to be here and super excited to get connected. I feel like getting connected to other people who have also lost a loved one or have been on this FTD journey is so important. So I'm really happy to take the time to talk with you this afternoon and share my story. My mom was diagnosed in 2011 around the age of 56, and she passed away in November of 2019. So she had this very long over 10-year journey with FTD. And I always say there was kind of like this slow ripping off of a Band-Aid where you got to experience what, they always tell you, rip off a Band-Aid fast so that, you don't feel what it feels like and it's over and it's done with. And I feel like the journey with my mom was quite the opposite. It was like, let's just peel and you can feel every single piece and layer and hair as we pull off that Band-Aid. So it was really long. It was really hard. But there were definitely silver linings along the way, and lots of information that we learned. So I'm really happy to sit here and discuss and chat and share and hopefully, help build awareness or help one person or other people along on their journey.
Absolutely. Absolutely. And thank you for sharing that. I think that's something I emphasize is we had very different experiences with this disease. And, I think as we've talked about earlier, we've seen Bruce Willis and his family, they became public with it and finally starting to shed light on something that's affecting a lot of people. But one of the things that I wanted to hone in on also are the different variants of FTD. So my mom had the behavioral component, which, kind of how you said, where it's one thing to rip off a Band-Aid and then there's like this slow burn of things. With the behavioral component, we definitely noticed that there was, even long before a diagnosis, very abrupt changes to her personality, where I felt over the period of 10 years, even since, I would say around her 50s, early 50s, mid 50s, where we just saw so much of who she was diminish. And, you blame it on different things, blame it on age, blame it on stress, blame it on, but I think when we had that diagnosis, it finally gave us an opportunity to sit back and be like, oh, okay, that this was something that was really wrong for a long time. But tell us also about, your mom had the speech variant, which is similar to, correct me if I'm wrong, with Bruce Willis. I believe it's called aphasia.
Right. So there are really frontotemporal dementia, the way I think of it is always kind of like this umbrella.
Mhm.
So just like you said, not every FTD case is the same. They're all very different, but they normally kind of fall into three main categories because usually it's marked either by changes in behavior, which was your mom, changes in language, which was my mom, and then sometimes there are changes in movement as well. And those are people that get both FTD and ALS together. So that's also a super common diagnosis. But like you said, what tends to happen because this disease can look like other things, and
Mhm.
because it's not well known, because it's rare, because there's only 50 or 60,000 people, who are diagnosed with it, as we know of right now, there is a lot of still unknown about it, a lot of doctors who don't know about it. So I think on average, the stat right now is that it takes about 3.5 years, almost four, for most people to get an accurate diagnosis.
Yeah.
Right? So that in and of itself is just a huge ballgame. I mean, people first told us that my mom had, my mom thought she had ADHD. At the age of like 50, she went and she got herself tested for ADHD because that's what she thought was wrong with her. And then you hear all kinds of different diagnoses and you go through multiple doctors until you're able to get a diagnosis. And
Mhm.
even then, right now, there's no simple test for FTD. You can't take a blood test. You can't go get a flu test. You can't take a COVID test and stick a swab up your nose and say, oh, yeah, you have FTD. It doesn't work that way because there's no biomarkers for the disease. They know a whole lot more now than they knew when I first found out what FTD was, but there's still no firm, you know, way to diagnose like there is with other cancers or other diseases. So I think that's what makes it so much more difficult.
Yes. Yeah. I remember there was, several doctors and neurologists that we had taken her to, and, taking her to a doctor in any regard always ended up being this massive, massive fight. And, I'd end up crying at the end of it. And they're just like, this is just something that happens in this disease. And they're at the same time saying like, it's hard for us to be able to give you, these different diagnoses. And one of the things that I thought that was really interesting, because she had gone through, MRIs and CAT scans as well of her brain. And one of the doctors had told us that, especially with where they were at the time, it's difficult until after they pass and doing an autopsy of the brain to really be able to tell that, which families don't have that kind of time. And I don't know that it would necessarily change the treatment. I don't know if you've ever have other thoughts on that though.
No, so and I remember, frankly, like, I remember when the doctor finally did diagnose my mom with FTD, and he said, "I'm telling you this." He was like, "But the could be completely different upon autopsy, because upon autopsy is really the only definitive way to say, oh, this was the actual pathology that was happening in their brain.
Right.
This is what caused it, and this is what happened."
Yeah.
So because there's no biomarker for it, because there's no blood test, they are getting closer in lots of research to finding out things and doing things.
Yeah.
But you really have to clinically rely on, a family's perspective of the behaviors they're seeing, what changes they're seeing, how it's happening, when it's happening, and things like that to really help put into context what they might also be seeing on a PET scan or a SPECT scan, and MRIs and things like that.
Yeah. Yes,
Yeah.
absolutely. And when you would listen through and understand all the symptoms, it's just like, yes, 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 all these different things, especially when it came down to the behavioral components. As I mentioned, it was about, the better part of about 10 years where we had seen a lot of these changes, and how she was, even social interactions, where my mom was this socialite and, socialite of her city. And, then there was like, she started hoarding. And, that was a certain thing that came up for us where we're like, what is going on? And, amongst many, many other things. And especially when it came to some, just unfortunately bizarre things that had transpired where, it took her starting to kind of, I guess, a lot of her relationships started to fall away, and no one really understood how to engage with her because no one understood what was going on because she was not receptive to getting that care. And, with 10 years, I think the other thing that just blew my mind when this happened was they're so young. This is something that is affecting people in their 40s and 50s and 60s. I mean, my mom was 68 when she was finally diagnosed. But for having something like this, for what we believe, again, to be a better part of 10 years, and I think you said your mom was 50, mid-50s at the time.
Yeah. Mm-hmm.
That is so young.
It's so young. And sadly, it's the hallmark, right? It's like one of the hallmarks of FTD is that normal onset is between 45 and 60. Although I have recently in my like journey with as a volunteer and meeting families, like I know families that have had daughters and sons diagnosed in their 30s, and that's
Gives me chills.
young 40s. Like it's so heartbreaking because people in their 20s, 30s, 40s, you're kind of in like the prime of your life. You have a lot of things happening. You may have young children, like lots of different things are going on. So it's not just Alzheimer's where you may have lived your entire, 80 years or whatever it is and had this life and now this is happening, but it's really hitting in this like hallmark pinnacle peak of most people's lives and kind of cyclically exploding everything that's connected to what that person has going on. And also it's unknown, right? So you see these behaviors that you're seeing in your family members change, but you don't know why it's happening. It looks like lots of other things. Like it can look like mental illness.
Right.
It can look like psychotic breaks. It can look like different things. And if people aren't aware of the fact that, oh no, this person didn't like take milk off the shelf in the supermarket and drink it in the aisle because they didn't realize they weren't supposed to do that. The frontal part of your brain that's responsible for teaching you about social norms and things like that is not operating in this normal capacity anymore. So that person doesn't know what they're doing. I remember one time walking down the street with my mom and I told her, I was like, you're chewing gum, but you need to get rid of it because I think we were walking into a doctor's appointment or something. Normally my mom would have like taken her gum, put it in a napkin, found a trash can or something like that. And she just spit it out on the street. That's like not something my mom used to joke. I have two sisters and she used to say like, we were always going to Anne's finishing school with like manners and stuff like that. Like it's the complete opposite of what she would have done. But she just, took a big breath, spit that gum out on the street, was like, oh, okay, I'm good. But these are just things that you don't know. Once you're aware of what's happening, you can kind of set context for that. But the symptoms of FTD and the hallmarks are usually, that there's this huge loss of apathy, right? So people just become super apathetic, but also that their behaviors change because they no longer have a construct in their executive functioning in their other lobes about how to behave, what is proper behavior.
Yeah. And that is it's a heartbreaking thing as a family to watch that because you watch this person that is seemingly okay from the outside and you lose them piece by piece every single day. And, someone's like, after my mom had passed, like, how are you doing with things? And I'm like, I feel like I've said my goodbyes for the last 5 years. And it's gut wrenching because, again, my mom was somebody that was so bright and, to your story about like spitting out the gum, like there were times where she'd be at the grocery store and then something would happen in the checkout lane and she would explode at this person, explode. And knowing who my mom was, she would not have wanted to see herself in that state. And your heart in those moments as like the family, you're just like, it's so hard to watch.
It's so hard to watch.
Because no one else from the outside understands. This is something that could be just normal for this person at any
right.
point. But when you're in it, it's just like,
yeah, I think there's, I don't know. I see other diseases. I've seen other people, but like in this disease, you literally watch the essence of what made that person go away. Right? They literally, in so many ways, either lose their language to communicate with you or their behavior changes, but like they literally lose the things that made them who they are. And you have to watch it happen. And that is gut wrenching, like as you said, like to watch that happen with a person. And then I think also to not be able to talk to the person about that. Like for me, that was so hard, right? I remember, like I've lost grandparents before and, I've had people get sick in my life, but you're able to have a conversation around what that experience is like and maybe, how you're feeling about that. But with my mom, we could never really talk about the fact that she was not herself anymore or that this was happening and she was going to degenerate and she was going to pass away. Like we couldn't have those conversations together. We couldn't kind of process that. And I feel like you have to watch that person wither away without being able to communicate in a normal, quote unquote, way with that person. And for me, that just made it so much harder.
So much harder, because even if you would try to communicate those things and explain what the doctors are trying to tell them, in the case of my mom, it was complete disbelief, never, ever, did not want to accept any single part of it. And within 5 minutes of us leaving, forgot any of it. And it was so hard because at some point I remember I would repeat myself a lot. And I had read something where it's like, you have to you have to learn a whole new level of communication and listening and speaking when it comes to dementia patients, because it's not her fault. It wasn't her fault that she did these things. And a lot of the things that she would do, I mean, they were hurtful. They were hurtful, but you had to just step back and understand that just wasn't her.
Right.
But I do want to ask you, with your work with AFTD, are there specific, I guess, conclusions or hypotheses of like, how are people developing this? How are people developing this so young? I mean, I know that we can look at genetics, but I mean, I'm somebody that believes that genetics it doesn't paint the full picture. What do we think might be contributing to the a frontotemporal, diagnosis?
So I'm only a volunteer. I've only ever volunteered with AFTD.
Sure.
So all of my, information that I've picked up along the way has just been from listening to speakers or reading things and, different things like that. And I still think they don't know. Like they know, certain pathologies for certain genetic components,
Mhm.
and where it is genetic, they know that it has to do with a certain gene. They know about more genes than they did, 10 years ago when my mom was diagnosed. But I still don't think they know like exactly why and it happens. We know that there might be tau proteins that build up in the brain and different things like that, but I don't think they know like, oh, X happened and, it's not like you got a concussion or you were in a car accident or this happened. There's still, so much that's unknown
Right.
about what causes it. It's 60% of the cases are still sporadic, 40% are genetic. From the last,
Sporadic.
from the last things that I have read and things like that. And that could continue to change.
Yeah.
So yeah, there's still so much that's unknown.
Yeah.
Yeah.
With my mom, I will say, I mean, she was one of the hardest working women I have ever encountered in my entire life. But it was always extreme. Like she ran on being stressed out, and she had many years of running on empty, not sleeping, like treated depression, and then also there was times where like her doctors would put her on different antidepressants or anti-anxiety medications. So I guess in my own hypotheses, when I look at it and the more I'm starting to learn about neuroplasticity and how much we need these things to be connected and wired, I beg to ask the question of, does years of having untreated depression and anxiety and stress and burnout, can it be contributing to leading to things like this, leading to diagnoses like this? Because we know that when you don't, lack of a better word, address your shit, it shows up in our bodies.
100%. And I feel like people ask that question all the time. I ask that question all the time, is there some way, like if I maintain a stress-free life, even though that's not possible, but like if I maintain, like a good level of stress and I try and keep my cortisol levels down all the time. I mean, I'm a yoga teacher, but that doesn't mean that my cortisol levels are down all the time. But you know what I mean? Does that mean like I'm not going to inherit the same genes, or if I have my mom's gene, even though I don't know if she has a genetic component to anything, like, am I gonna, can I help myself not develop it? I don't know. Like I think that's one of the things that's really hard about dealing with FTD and the dementias is there's still so much that's unknown.
Yeah.
And I think it really, like I think if it taught me anything, this journey, it gave me a really good life lesson in kind of how to really sit in the gray area of life. Because I feel like it's really easy if things are black and white, right? Like you might not like the black and white, but life is easier when things are clear cut like that. But I think what FTD taught me in this journey with my mom is that there is a lot of gray area in life. And the more that you can kind of figure out how to give yourself tools for your toolbox about how to deal with that gray area, the more you're going to be able to kind of go somewhere from that space rather than get stuck in it.
Yep.
So that for me is what I try to do, because I feel like I don't know those answers yet. And I keep exploring it and I keep reading research and I keep hoping one day, like we'll know that answer, but I don't know when or if or.
You're exactly right, though. That having the awareness and having those tools to our minds and our mindset in any given moment, and that comes down to mindfulness, which I think is it is becoming more at the forefront of a lot of conversations now. Not the World Economic Forum, but the Surgeon General's office just issued a workplace mental well-being framework and resources. So I think we're finally waking up to it. And one of the statistics that I'd shared at the beginning was specific to the United States, 50 to 60,000 Americans. This isn't even broad into, what's going on around the world. But I do know that in America, mental health we've got to figure this stuff out. I say figure it out like it's going to be easy. And, there's good conversations happening, but I'll leave it to that. It's good for us to have the right tools and support systems in place.
Yeah. And I think, unfortunately, with FTD, as much as, like this disease degenerates the person who has the diagnosis, and it really affects them. And they're the ones who you see have all the behavioral changes and you see wither away. And ultimately, sadly, they're the people that pass away. I feel like there is just as much of a burden and an impact on the caregivers and the family members and the people around them. And it's so hard because you're caring for this person. Meanwhile, and it kind of takes over your life in a very different way, I think, than it does with other diseases. And meanwhile, you're still dealing with yourself. Like you still have to live, you still have to go on, but it's the burden financially and emotionally on those caring for people with this specific diagnosis is so different and so gut-wrenching in a way that I haven't seen with other things.
Well, that is a good segue into our next question, and we'll have a few questions in regards to caregivers. So for those watching, definitely stay tuned. I also want to mention that I'll have some cue markers in the description. So if you guys want to fast forward to specific parts, but let's talk more about what caregivers should know, or what should caregivers know, because it's an unpredictable journey. It is extremely unpredictable. You touched on it a little bit when you said, the financial aspect of it, trying to piecemeal everything apart. When we first really just started discovering this, and my mom had the best memory of anybody I've known. What really cued us off to this was in 2019 when she started getting lost driving, and we're like, you're driving down the street, what do you mean? We lived in Dearborn, and like one night at 11, she went to go pick up milk and ended up in Ann Arbor, 45 minutes away. Now my sister and I live in North Carolina. She's in Texas, and we're like, I can't be there to help right now. What is going on? And I think that's what cued us off to something's really, really wrong right now. We've got to figure this out. And I remember going home, and it was like Pandora's box, for the first time having to really dive into what's going on with the finances. Has she been paying bills? My dad they were 20 years apart. So my dad was 84 at the time. And so I felt like this box exploded. And luckily she was of the mindset already where I remember she knew something was up. she knew something was up with how she was forgetting, and she demanded she was an accountant, and she was like, you need to get this paperwork signed. I need to get you power of attorney. And that was like interesting for
She
me.
knew that was huge.
Oh, because I was just like, my mom, like, this is, I was 30 years old at the time, and I was just kind of like, okay, like, what is this? What do I got to do? What does this mean? And it was both a blessing and a curse, honestly. I think what I would say for caregivers, if there's one thing that I would definitely say upfront right away, have these conversations with your parents now. If it's FTD or whatever it is, understand the executorship, understand power of attorney, and understand what it means to be both a power of attorney on medical side of things as well as the financial side of things.
Yeah, 100%. It's almost like there's one thing, two things really. I would say, like, one, kind of get your ducks in a row,
Yeah.
and two, build yourself a network of support in whatever manner you need, whatever that looks like for you. But like, ducks in a row, I think, is so important. Like you said, your mom kind of had the wherewithal, like she knew, right?
Yeah.
She was able to do those things. My mom didn't, but my dad was so practical and so on it that he like took all the steps to figure out, okay, what do we have to do with Medicare, Medicaid, and switching power of attorney, taking things out of my mom's name, putting them in his, like, so
Right.
many things. And I'm so thankful that he was as practical as he was, because it made our lives, so much easier, because he was really good about that stuff. But so many people don't, and you're so overwhelmed because you've just been told that this person has this neurodegenerative brain disease, and in 7 to 13 years or 5 to 7 years is going to pass away. Like, shit, you know what I mean? Like, so then you're like, okay, now what do I do? And no one necessarily likes to talk about those types of things, or there's a lot of paperwork involved in power of attorney and executorship, and going through Medicare and getting all that kind of stuff taken care of. But once it's done, it is a huge, like, the fact that it's done is just so much easier, because if that person gets further into their disease and they're more incapacitated and can't do things like that, it just makes it all the more difficult.
Yep.
So I think to get all that stuff in a row is super important. I think the other thing, and the thing that I know people never want to talk about, is to talk about the practical piece of what happens to that person when they do pass away. Like, I know that no one likes to think about those things, but to have to deal with that stuff at the end, like when the person is actually passing away, is so much harder than to do it beforehand. So having those difficult conversations, I think, is really important. And then, finding a base of support to help you deal with those things. Like, maybe it's, you bring on someone who's really good with paperwork, who can just help you kind of navigate what you have to do, a friend who will, go to the DMV with you, or, all of those things that are not fun to do, but just to kind of have that extra support along, because you can't do it by yourself.
No, and especially when, I feel like so many of these memories flood back into me too, where you're already on this high drive of emotion, because with behavioral, for me at least, it was like I never knew who I was going to get. I never knew what stage she was going to be in. And so every day was just these extreme up and downs. And then when I say it's important to have power of attorney, I emphasize that, because even though I had power of attorney in a lot of these instances, it was still a pain in the ass to facilitate some of the things that I had to facilitate, from Medicare to Medicaid to their bank accounts to paying bills to, working with the physicians and the doctors to, I mean, even when it came down to like the nursing homes, they weren't, my mom was, I think it was all of 1 month that we were able to find care for her, but it at least made it a little bit easier. But I mean, I remember there being times where I was on the phone with their bank, and their questions and send me this paperwork, and I can't do this until this, and this is going to take you 2 weeks to get. And I just remember crying to these people, like, my mom is
like, you have no idea what you do. Right.
Like, I just need someone to understand me. And I wish I wish there was, I mean, I think from a very practical standpoint, that's probably the best advice we can really give, because every day is going to look different. And I think for, my mom at the time, it was frustrating, but because my mom and my mom was an accountant, my dad was an attorney, and they spent their careers helping people plan their estates. But we didn't realize, with so many years of just like, okay, mom is mean, and she's, we had to create boundaries at these times, in our lives and in our new marriages and what was going
Right.
on. And I feel like sometimes in those moments where like things were lost and scattered everywhere for them. I mean, it was impossible to find. And so I think the one regret that I had was just not pushing harder earlier. And, I remember there was years before where I had noticed these changes and tried to get help from social services. These systems that are set up to help us, they don't
Are
sometimes.
so complicated to navigate, and they don't really know how to deal with like a younger
No.
diagnosis. Like all the things that come along with FTD are not necessarily things that people are going into those systems for at the age of 40, at the age of 45, at the age of 50, at the age of 55. Like, so you're going through so much red tape that it's not really set up for you to go through until that person is necessarily older. And then you're dealing with the emotional component that goes along with it. It's just, it's so complicated. And I think there are a lot of people out there who understand the systems. So like, if you can advocate and find those people, I think, you kind of have to figure out, like, ask for as much help as you possibly can. That
Right.
would be my other big piece of advice. Like, the more help, I think the more support you have, the better off you
Mhm.
will be.
The one thing I do want to share for anybody navigating the behavioral component too is, when you talk about getting the extra help and the caregivers, with the behavioral component, I ran into the essence where my mom would shut them out. My mom would not accept the care. It would then turn into a massive fight of like, I don't need this. You need to leave me alone. Don't do this. Don't do that. And so you sit there from this perspective of like, I'm just trying to help. I'm just trying to give you resources. I'm just trying to keep you safe. And as a child at any age, when those roles reverse and you're in this stage of like, they're still young, you're still young. I mean, I think you and I are about the same age. That's a hard place to be. And trying to convince an individual that no one's trying to hurt them, we're just trying to get them help. So I really, with any variant of this, like, it is extremely hard. But I just remember times with the behavioral component where it was blowups left and right. It was hard to even get them that help and for them to receive that help too. Excuse me. Um,
It's very different on my end because I don't have experience with the behavior. My mom's all language based. She never really like, there was no outburst. There was no like hard pieces per se in putting that together. It was hard to like help her and hard to like be with her and figure out how to help her do things and stuff like that. But she wasn't necessarily like resistant to certain care and things like that, because she didn't really have the language to kind of talk about it. But it's just so, like you said, to watch that role reversal, especially as the child of a parent, is so hard. Like, you start to parent your parent, and that's like it was a very weird emotional thing to do
yeah.
and go through.
Yeah. For
It's
for
really,
any case of it. I mean, even in the dementia diagnosis or any illness,
I mean,
you grow up quick.
you really do. Like, you really have to, yeah, I feel like it was a very big, like, okay, you got to really put on your big girl pants here. And
Yeah.
like, this is, you have to like shit or get off the pot because like you have to do it. But
I
that
gotta
being,
leave because that was one of my mom's favorite sayings. Later you go off the pot.
but
That
it
was
was
great.
so hard to, like, I say that and I laugh about it now, but like, it was really hard to do it. It was
Yeah.
really, I don't think there was anything,
There is no
like,
manual in this either. Everyone's situation is different.
is totally different. There's never in my like 30s did I think I'd be spending, like the Friday I had off going to like drive an hour and a half to visit my mom in a memory care facility, like, or tagging along, my 20-month-old baby in her car seat to go like visit her grandma in a memory care. Like that was just not something that was ever in my wheelhouse about like what, taking care of a parent would look like.
And having children at that time too. I mean, I did not have children. I mean, my husband and I had just gotten married about a year and a half prior. So we had a new marriage. We were trying to keep together during all this, but having a baby and all that too. I mean, I guess a blessing because, she did get to meet your mom, right?
She did, but it was, like my mom was never able to hold my daughter. Like my mom was never able to babysit my daughter. My daughter, and so my daughter said to me the other day, she was like, I feel like I really know like who Nani was. And I was like, really? I was kind of like I was taken aback. My heart kind of broke a little bit, but she was like, you tell me and you teach me so much about her.
No.
And that made me so happy. But like, it's really because I have taught her and I've told her about her, not because she got to like see my mom as this vivacious like grandma that I thought that she once would be when I was much younger, Yeah. So it's just, you really have to kind of start to wrap your brain around, and then you are becoming a parent as you're losing a parent. That's also a very weird thing. Or you're becoming a wife as you maybe thought like you would talk to your mom about, oh, what's married life like? And how do I, how did you do this? And how can I do this? And like, no, couldn't have those conversations. Like that wasn't, no.
You said something important, and as you described, how you talked to your daughter about Nana. Is her name?
Nani, yeah, that's what we call her. Nani, yeah.
We have to hold on to the good parts.
We have to.
Because, you get to this point where you're caring for somebody that you don't know anymore, and it's tough. I mean, like I said, my mom had like, her relationships. Like I was all she had because of how bad it had gotten, and everyone knows when you look back, it's like she was this vivacious person and she cared for everybody and did all these things for everybody. But that's really what you have to hold on to, hands down.
Yeah, there's an amazing podcast group, and their slogan is "Accept the Good," and I think it's just that's what you really, like that. There's so many hard things about this diagnosis, about this journey. There's so much that's complicated. There's so many family dynamics that I think if you can find the ways to like accept the good and accept the little things along the way, I think it just, it helps empower you in a way that you might not have realized that you needed.
Yeah. Well, I'm going to switch up our questions here because I think it's important to change subjects, not change subjects, but related to this subject is how to care for caregivers. This is a tough one. And you mentioned this a bit ago in regards to this is a diagnosis that not only affects the individual, but fundamentally turns a family upside down. And I don't say that in regards to diminishing any other type of diagnosis, whether it be cancer or other, but this is like you said, it is for you. It was a decade. It was over a decade.
Yeah.
And I think when it came down to it is I'd found two Facebook groups. Children of Frontotemporal Dementia was an amazing group, as well as I think it was just called Frontal Lobe Dementia. So there are two Facebook groups that I had joined pretty early on, and I can't tell you how, even though these are people that I didn't necessarily know, just knowing that I wasn't alone, knowing that the crazy things that was going on in my life. And I mean, there was several times where we had to have the police at our house because things just got completely chaotic, and she would try to drive off in cars, and to see that this was something another family was going through. I don't know how to put it into words, but just to know that you're not alone and have the empathy to know, like, my heart goes out for these families so much, because I know how hard it can be. And to know that you're not alone, and to know that you can even like comment on someone's, status about it, I think was helpful in some capacities.
Yeah, I feel like anything you can do to like help that burden of isolation is huge, because I feel like it's super, no one likes to talk about things like dementia and, watching your parent kind of wither away, or losing, like, these people losing the essence of who they are. Like, those are not easy things to talk about. So I think if you're able to connect and find someone else who maybe like you, our stories are different, yet I feel like there's this just kind of shared empathy of understanding, like, oh, this person gets it. Like, this person has been in not maybe the same exact pair of shoes, maybe different size, maybe different color, but like, the same brand, the same model. And I think like finding that, like meeting people for me that were in similar situations was monumentally like life changing. I was like, oh, I didn't know that I needed these people as much as I needed to be around them. Some of them I like never met in person, only ever met them on Zoom. Through my volunteer work that I did with AFTD, I was able to meet like a whole host of other people like me who were children of parents who had a diagnosis. Some I was able to work with, some I'm like so happy to call my dear friends now, like I can text them when I need, and some of them were at my mom's funeral. Like, it's just, those are things that I will be forever, ever grateful for, and that I never knew that I needed, right? Like, whoever thought I'd be excited to like go to an AFTD conference and learn more about this dementia and talk to people about the fact that like my mom was dying or had died, but like that I go in this kind of very comforting space to be in, because those people understand. So I think caring for caregivers is super important. And I think being able to give caregivers the opportunity to connect with other caregivers is really important. And that being said, everybody's different, right? So everybody needs something different. Some people are going to want a big base of support. Some people are going to need one or two or three people. And I think it doesn't matter what that support looks like, what it is for you, but I think kind of formulating some type of not care plan, but just support network is the best way that you can care for caregivers. I also think, like, I don't know how this felt for you, but I think when people did things for me without me asking, or did things for our family without us asking, I think those were the things that were most cherished. Yeah. And it wasn't necessarily like, that maybe it was that they brought a meal, or like they offered to take my mom out for an hour, like those kinds of things. Sometimes it was just that they like checked in,
Yes.
and that they were like,
how are you doing? It's couldn't agree more. And I think I had a lot of friends, because I'm not from North Carolina. My mom had moved down here, and so I mean it was just us and my husband and I, and I'm trying to keep, a new marriage afloat and understand what's going on in these circumstances. And so it was, finding people. I mean, I had girlfriends here that would go and stay with my mom if I was, trying to go out of town for, to have a time away with my husband, or go out to dinner, or, sometimes my mom just got sick of me. And I had friends that would show up and bring her meals. And, I think there's a lot to that. And I think that, it's kind of this secret society of hell sometimes that we get into, and this secret club that we never wanted to be a part of. And I say secret because it still has this stigma, like you said, where it's like dementia, or like, anything to do with mental health. And I remember there was a few times that I had posted something about her diagnosis, and rather than, publicly saying anything or commenting, people would privately message me and be like, hey, my mom is going through the same thing. Like, what's up? And that's fine. If you want to keep it private, that's fine. But
yeah,
it also makes me realize that we have such a stigma about this, where we can't hide from this anymore. Families can't hide from this. Families need support, because these types of diagnoses can rip families apart. And at the same time, all you try to do is your very best for your loved one. And not everyone is going to accept the route that you go, because not everyone is sitting right in your shoes, or standing or walking in your shoes. Not everyone is showing up to do the work. And it's amazing how people on the outside can have a judgment on something that they know nothing about and want nothing to do with.
Mm-hmm.
And so finding your people that show up and support you in this journey is key. I'll switch gears a little bit because I think as individuals, we also have to place personal accountability and even some boundaries sometimes, because it takes a toll on us mentally, emotionally, and physically.
Yeah, and I think you really have to do best what you can do to protect yourself. And I think, it can be different for different people. All the circumstances are different. I wrote a whole chapter for a book called What If It's Not Alzheimer's, on self-care for caregivers. And I think you really kind of have to craft your toolbox, right? Your toolbox might be simple things that you like figure out how to do in the moment. Your toolbox might mean that you have access to be able to put someone in respite care and go away for a week and come back, right? Your access might be that you get to go for a walk for 5 minutes down the block while, your next door neighbor sits in your house with your loved one for 5 minutes. Like, everybody's thing is going to be different. And so I think just kind of figuring out how you can craft it best for yourself is important, and remembering that like you're doing the best that you can.
Right.
I always remember saying to my dad, like, we have to do whatever we can to take care of mom in the best way that we can, but also like I don't need to lose two parents right now, right? Like I have one parent who is healthy, who is well, so like I want to do what's best to take care of my mom, yes, but like what's best to take care of my parent who is still here, so that parent can thrive, so that like our family doesn't disappear because that happens. My dad had a heart attack in the middle of all of this and had to have quintuple bypass surgery. And I just remember thinking to myself, like, oh my God, like this is like, here we go. Like, this is not just about my mom. Like, we need to take care of my dad. Like, this is important. This person needs to stay stable. I don't want to lose two people. I need to keep one, so I think you have to, and it's hard. And I don't think there's any right decision, right? I think it's just what you're able to do with where you are and what you're able to emotionally deal with and what your finances give you. Like, I think there's just, and it's hard. There's no right or wrong way.
There's no right or wrong way. And you're right. I mean, it's like, it was kind of where I looked at too is, my dad was 87 at that, closer to when my mom had passed away. And yeah, I mean, you have to focus on what is still around, what is still the good in your life. And, I had to set clear boundaries, because I'm like, I can't lose my marriage and neglect my marriage, because I mean, that is my future. And I can only do so much. I can only, my mental capacity, and anyone's mental capacity can only do so much. And I think with how much of a weight this can be on the caregivers, because my mom never thought anything was wrong. She was just going about her day like it was, everything she was doing was completely fine, completely normal, outbursts normal. And it's, I think I had another point that I wanted to bring up about caregivers too, because self-care, you can't consume like these bubble baths are not going to do too much. I mean, yeah, it helped a little bit after a stressful day, or if I had she would get up at 4 a.m. and be calling me endlessly in the middle of the night. And sleep was something that I realized after the fact that I had neglected a lot too. And like you said, if you have it within your toolbox to have respite care or a friend that can go and have lunch with them, I mean, use those tools, use those resources. I think I want to also include, I'll have a link in the description of this for both of those Facebook groups for folks to join, so those Facebook forums. And then I'd love to get a link for the Self-Care for Caregivers, the book that you had mentioned.
Yeah, there's a book, and I also did a webinar for AFTD in the middle of the pandemic, and we can post that link too, because that's a lot of that content, but in video format as opposed to in a book.
Perfect. The more resources that we can get out there, I think
the more resources, the more you can do, the better off. Not that you can change the situation, but just the more you have at your disposal hopefully the more you can be a little bit more supported in your journey. Yeah.
The one other thing I wanted to talk about that came up in my mind with caregiving is expectations. I think that was something I struggled with for a very long time. We kind of mentioned how it's like you're slowly losing this person and you have this glimpse of who they were and then now where they're at. The one thing I really struggled with sometimes was also accepting what was going on. And it's hard because I remember there was Christmas where I was like, she's going to come over, we're going to make pierogies and we're going to, have this big Polish Christmas and it's going to be great. And we're going to open presents and all these things. And I'm like, I'm a 32-year-old adult. Okay. Like, and when it didn't happen as that, and when we had another blow up and we had more chaos, and I'm sitting Christmas morning in tears because my mom is saying mean things to me. It's like, but you knew better. And it was
hard. You can say that to yourself now, right? Like hindsight is always 20/20, but like you don't always know when you're in it. So it's like anything you can do that like can give yourself just a tidbit of space, but also like you said earlier, right? Like to remember that they are not their behavior.
Right.
It's just so hard in the moment because I think you're grieving and you want that person to be themselves, but they're not. And so, and I think it goes back to your point that you said earlier to just try and like remember the things that are good and like, make a new kind of crazy situation different maybe than you ever wanted it to be, but like, what is it? Like, what's really important,
Yeah.
Did I ever think that I would spend like a fake Christmas in my mom's memory care unit, like 3 weeks before Christmas and like bring in a little tree and decorate? Like, no, I never. Christmas was my mom's absolute favorite, like hands. I mean, she was like a Christmas fanatic. So like to know that like that no longer existed was really heartbreaking, and that we like did it in a like that. It was so hard. It was weird, but yeah, we did it. And I was like, okay, this is what, and then we went out for milkshakes after. She would have loved that. But like, that's what we did. Like, that's what we had to do, like, so that
best of it.
Yeah. To make the best of it. And it's hard. It's really hard to do it. But I think, you kind of, like you said, you have to give yourself that space to be like, okay, this is going to be different. But yeah, expectations, like knowing that you can't expect that that person is going to be the same that they were before, and that you have to constantly kind of remind yourself that their behaviors or their whatever they're showing you is not who they are. That's not what they are, right? So it's like you have to go back and like remember, and it's hard when you're in it to remember what they were.
It's so hard when you're in it to remember. It's so hard. I mean, I've been a yoga teacher. I've practiced mindfulness, and like, again, I'm an adult. I should know better in these moments. And then it comes up and it doesn't go as you planned. And then I'm the one left disappointed because of my own expectations that I placed on somebody else that I know can't control their own. And it's, I think that if that was, another bit of advice that I'd give for the caregivers of loved ones is go easy on yourselves.
Yeah, go easy on yourselves. This is a hard road.
Be gentle. And, if you have the means to seek out therapy or talk to a counselor, please, 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 please. I could not advocate for that enough.
Yeah, I don't think I would have like survived, like it was a huge, huge thing for me. It was really hard to do and really hard to go. And there were days that I didn't want to go. I didn't want to talk to my therapist. I was like, I want to go to yoga instead of going to therapy. But, like even now I still have a relationship. I don't go as often, but like, still have a therapist that I can talk to. And I can't, like, it's just so, so, so important.
Yeah. Which, okay, on a lighter note, kind of funny, my therapist that I had seen for the last 5 years, her name's Dottie, and she was with me throughout this entire process, before the process even, because, my mom and I had a very different relationship anyways. And so I'd started with her, and she messages me. She's like, yeah, so I'm leaving and I can recommend you to somebody else here. And I'm like, you know too much. You're not wait, I've been with my therapist for 5 years. You don't just tell me you're going to another place. And, like, No. You are taking me with you. You're never retiring. I will be with you till the end. Like,
It's
no,
hard.
yeah,
Yeah.
it
No,
is. It
it is.
is.
Yeah. And
So,
there is support out there.
what's that?
I said there is other support out there. Like if you
Right.
can't get a therapist or you don't have access, to that type of psychotherapy and things like that, there
Yeah.
are support groups. There are things that are free. There are things that are accessible for
Mhm.
caregivers. So I think as much as you can to try and like seek it out is super important.
Right. Right. Well said. Well said. And on the topic of support, and another tough topic when it comes to healthcare and medical professionals and the whole system. Let's talk about what does it look like to navigate healthcare with that FTD diagnosis.
I think it can look like a little bit of a clusterfuck.
Good way to put it.
It's difficult. I think it's difficult. Healthcare in general, I think, as a healthy person, can be difficult to navigate, right? And I think you unfortunately like have to be a really kind of squeaky wheel, and you have to be an advocate, and you have to just continue to like push the not the boundary, so to speak, but you really have to
Uh,
push for support and for great care because there's so much to navigate in
Yep.
the healthcare world. There's so much attached to it, and there's still so many providers that may not understand, like, oh, your mom still may have to go to the dentist, your dad, your brother, whoever it is, like,
All
so you
these.
have to teach the dentist about FTD, and you have to maybe at one point make the decision, like, is their dental hygiene important, or is their like safety and keeping them calm important, right? So it's like, at some point, maybe that goes right. Like you have to make those hard decisions too in
Yeah.
terms of healthcare. But yeah, there's just a lot to navigate. So I think being a really loud advocate and an educator for the healthcare people that you're going to come in contact with that don't necessarily know what a dementia, even not even FTD, like don't even understand dementia or like
Yeah.
just talking about what it is that is going on with your loved one as you navigate your way through it, I think is really important because I think if people understand, then hopefully they'll have a little bit more compassion
Mhm.
as you make your way through the healthcare, um, you know?
Symptoms and yeah.
Yeah.
Yeah, I think I could not echo that enough because I remember when my mom, how this all came to a head. There was a few other things that really erupted, especially because my dad, 87 at the time, called me in April of 2020 and was like, "Your mom, I can't do this anymore. I can't help her." And that really ignited a lot of these different things, and ended up where she also had diabetes, and so we ended up with a medical emergency due to her diabetes. She, did not want to listen to anybody. Nothing's wrong with her. She's going to eat the way she wants to eat. And she ends up in the hospital and tried leaving the hospital at 4 different occasions. And so that was a whole thing. And it finally was like me begging these nurses. And the problem that I will say that, and I understand like there's so much going on,
So
but to
much going
have
on.
to repeat the same trauma over and over and over and over again because you have nurses that come in every other time and doctors that come in every time, yet there are notes. That was something that really, really got me because, I'll share a story here in a second about, where we got at the end, but it took me begging these people to get her psychiatric care for them to understand. I don't just need you to look at the fact that she needs help right now for diabetes. It's that what is going on at home cannot sustain what and how she is living. I need someone's help to help me navigate this. And it was the first time where I was just absolutely shocked in how long and how hard I had to push.
Yeah, it's because you're emotionally like so drained, and then to have to go through all of that. But it's really, yeah, it's so the stories that I've heard about how much people really have to advocate, and build awareness and teach people about what the need of their loved one really is so that they can get the best care is really important. And that's why I think, having these conversations like you and I are having today are so important because I think if one healthcare professional hears it or, someone like, I just think the more people that can understand the needs of the loved ones that we have is really the best way forward to get more supportive
Yeah.
healthcare around people that are dealing with a FTD diagnosis.
And don't get me wrong, they've got a tough job. I understand that, these nurses, God bless them, because, and the doctors, like they're doing a lot of work and don't have enough recognition that they deserve.
100%.
And
100%.
isn't something, when you look at, if someone comes in with a broken bone, it's like, okay, well, we got a solution for this. We're going to go ahead and fix this bone, send you on your way. Good.
Right.
This is mass chaos. It is, no one knows how to deal with it. You don't know how to deal with the patients. And I remember there was several times this happened where, and this was even a family physician that we had. And again, like she was somebody that we had known for many, many, many years and love her. But she, when I asked her, like, what do I do? What do I expect? She was one of 3 of my mom's doctors that told me, given her reluctancy to listening to medical advice, given her, refusal of any help, what we see in these patients is that you're just going to have to roll with the next catastrophic event after catastrophic event after catastrophic event. They weren't kidding. They were not kidding. And I would get so mad at them because I'm just like, what do you mean? I had one that was just like, well, she's been coming to us for 10 years and doesn't want to listen to us about anything. So we stopped even giving her these tests because why bill her insurance when she's, doesn't care? And, again, that's, in fact, I try and understand more about behavior change now in my, in some of the studies that I'm doing, but, that's a hard place to also be as a medical professional. And I have to empathize with them because they don't show up to work wanting to tell anybody that, wanting to tell a family member, I literally don't know how to help you. But I think with behavioral dementia, that is something that I want to share because that could come up for people. Yeah. And in some of these groups, I've seen that happen. And I mean, I remember, as my mom progressively got worse, there was another episode where we basically would have to force her to have a surgical procedure and she would fight it. And I'd literally I'd have special permission to walk down and wheel her into this room with them because I had to be there or she wouldn't do it. And there was, the time where this physician sat down and she's just like, do you want to keep going through this? Or will you give her dignity and just let her live her life as she thinks she's going to live it? And, watching this happen and watching, I mean, the one surgery that she had, it wasn't, an hour later that she was out of surgery, that the medications that they gave her weren't working. And she was up walking down the hallway trying to escape the hospital. And you see these, all these people come in and try to like help. And like, at that point, there is a lot of trauma that goes into this for both the families and the caregivers, because caregivers, and not the caregivers, but healthcare professionals, this is not something that they look at on a daily basis. Like they want to help fix things. It's not a fixable thing. And you have to roll with the punches. But I really hope that healthcare starts to look at dementia and mental illness as you would anything else, any other illness. And we talk about this with open arms to people. And we talk about, the stigma that we have around talking about death and talking about dignity. I'll never understand because I mean, I hate to break it to anybody that might be listening to us, but that's kind of the reality of everybody. I mean, we're not going to avoid it.
Yeah. I think it's like you could have an entire conversation about it, but it's like, I remember I worked in early childhood mental health for a long time, and we did this whole bereavement like training in our program. And the bereavement trainer was like, this is the sticky stuff, right? Like this is the stuff that no one wants to talk about, but yet is a part of everyone's life at some point.
Right.
So we need to talk about it. And I think it's true. Like, I think these are the things you don't want to have to talk about. You don't want to have to like open up about. This is not the fun stuff. This is not flowers. This is not rainbows. This is not cupcakes. Like it is the reality of life at some point for everyone. So the more you can talk about it, I think the more awareness, the more education, the more, openness maybe you can have when you have to be in those sticky situations yourself, because they're not fun, but they unfortunately are a part of life.
Yeah.
Yeah.
Yeah. I think the other thing I'd mention too, and I don't know if you'd run into this much, but even with how insurance billing would run sometimes, that was really difficult as soon as you put dementia on that patient's chart. With my mom's behavioral components and the diagnosis of dementia, we found that it took 7 different homes that we had tried to call after the late stage, where they wouldn't accept her. And so then we were not only as a family dealing with, oh, this hospital is just going to discharge our mom back to us, who now has a surgical wound that needs to be cared for that we are not equipped to care for, who is now progressively worse because you put a dementia patient under anesthesia. That takes it another notch. And I mean, I remember just crying in fear because I'm like, I have no idea how to care for her or to keep her safe right now. And this hospital is just going to let her come to us. And after pleading with 7 different places, we finally got her into a lockdown facility. But it took 7 different conversations, 7 different times of having to retell our story. And again, we had such amazing advocates, especially at Duke University Hospital here in Raleigh, that they finally just sat with me and just carried me along the process. But it's freaking hard for people. And I remember they had to essentially add some sort of diagnosis at the end to have this nursing facility accept her for something specific. But then that changed how medical billing would bill different things. So when you say anything comes down to dementia or mental health, you're on the hook for a whole lot more costs. And there's no you can't give me an explanation for that. The other thing that I thought was really interesting when it came to the systems is, I think I'd mentioned social services, as well as some interactions that we had to have with our local police department. And I remember I was talking to the police officer, and he was just, at this point, I had to go fly to Texas to take care of my dad because my sister, who was, my dad was living there, was out of town at the time. So I flew there to take care of my dad. My mom is here in her, she had a condo right down the street from us. And she walks down the street, which she had done. She enjoyed going and talking to people at CVS. But then something had happened where the police came. And I was like, okay, well, she needs to go to the hospital. And they're like, well, she's refusing to go to the hospital. And I'm like, she has an A1C of 14. You have to take her to the hospital. And he's like, well, if she's refusing, we can't, or else it would be considered kidnapping. And I'm like, oh, I don't know what to do anymore. I remember just throwing
it's like it makes a complicated situation not much more complicated.
So I think the other thing that I would tell people and that deal with some of these things is, like, expect the unexpected. Things arise, and like you just gotta always just be like, all right, I just gotta roll with the punches, because there's no part of this that I can predict. Nothing at all.
And there's no part of it that's like normal and makes sense. So it's like you really have to almost like create like problem solving in a very creative, kind of crazy, off the beaten path, and every situation is so different. It's so different.
Well, I can't thank you enough. I hope that us having this conversation can just help some folks out there know that they're not alone, that it's hard. And there are people that are out there that see you, that support you, that care for you, that love you. And if we can advocate, and we're going to share more resources in our description after this, but know that there's help out there. And
there's so much.
Tell us, actually, before we close too, how can people get involved with AFTD, and what are some of the things that they need so that we can start driving more support to this organization?
So, I can't speak highly enough of the organization. When I first got really got relayed to the organization, it was much smaller than it is now. It's amazing to see like how much they've grown and how much they've done for the FTD community. And amazing to know that this organization was started by volunteers, by Helen Ann Comstock. She lost her husband many, many years ago. And like that to me has always been such a heartwarming thing. Like they get it, right? They're there, they really get that and they understand that. But there's so many things that you can do. There's ways to volunteer. You can go on their website and check out their volunteer page. Volunteering for me with them was a silver lining I never knew I really was going to find, because I got to meet so many people and share my story and do things like we're doing today. But there are support groups that they have available. There are support groups in not every state, but in many states and multiple in many states. There are Zoom support groups. Thank you, pandemic. That was a silver lining. There are a lot of phone support groups now that are available. They have respite grants available and different things like that. So there's lots of ways to get involved with the organization, and they're really hopefully, you know, helping to strive and drive research to a cure. So we can put their contact information in there. They also have a helpline. It's not staffed for 911 emergencies, but you know, you can call Monday through Friday, 9 to 5, and speak with someone. So they're a great resource.
Amazing. Amazing.
Yeah.
Well,
Yeah.
I can't thank you enough. And in honor of our sweet and loving moms, I hope that everyone out there, you know, as you see this, reach out to us. If you have questions, please, please, please don't hesitate. You'll have our contact info and a lot of the resources out here. But we're with you. So take care. And Corey, I know I'll be talking with you soon.
Thank you so much. We can echo that there with you and here. So feel free to get in touch and stay connected.